And this can be any joint problem. It could refer to anything. Could be knee pain, could be shoulder pain. But I'm focusing on the back because that's the majority of what I've seen elevate between 1990 and 2022. It never really descended. More and more people, and this perplexed me. I didn't understand why we weren't making any progress. And one of the things that I discovered is that you don't have a back problem, you have a body problem. So in 2009, when I would consult with people, and now when I consult with people and they come to me and they say I have a knee or back or neck problem, I say, well, what you're going to learn today is that you have a body problem. And that when I look at the body, I look at the body as a whole and not the sum of its parts. So right off the bat, experts estimate that as many as 80% of the population will experience a back problem at some time in their lives. Current treatments for low back pain lasting longer than a year are expensive with questionable efficacy and safety. Low back pain is the single leading cause of disability worldwide. One half of all working Americans admit to having back pain symptoms each year. Americans spend at least $50 billion a year now annually, and across the board, it was, what was it before? 635 billion. Now get this, approximately 90% of lower back pain cases are considered non-specific or idiopathic, meaning the cause of the pain cannot be confidently attributed to a specific underlying spinal condition or tissue damage. All right, so despite all the advancements in technology, education, orthopedic, and primary care medicine, physical therapy, and corrective exercise, why are we still seeing a continuous rise in lower back pain and injuries? According to the Journal of American Medical Association, there has been little improvement in health status, functional ability, workability, or social functioning of patients suffering from spinal disorders. What's missing? The solution to this orthopedic dilemma is to take an integrated and holistic approach, focusing on the whole person and treat the cause and not just the symptom. So as you look at this slide, you look at 1, 2, and 3. Now those are obvious and the other ones become obvious, but look at number 6. Now that is recently been added in discussion across the board. Now everyone is starting to recognize, physical therapists, athletic trainers, personal trainers, etc. They're really starting to look at unhealthy lifestyle factors in relationship to musculoskeletal injuries. Again, you have back pain. What does emotional stress have to do with back pain? What does biochemical stress have to do with back pain? Nutritional, well, we know what physical stress has to do with it.